Good afternoon, everyone, and welcome to the Penn State College of Medicine COVID-19 ECHO series. We're delighted to have you join us for today's session. My name is Jackie Sable. I'm a member of the ECHO team, and I'll be facilitating today's session. A few announcements before we begin. If you've not already done so, please put your name, email address, and affiliation into the chat box for our record-keeping purposes. Please stay muted unless you're speaking. You can use *6 on your phone or the microphone icon on the bottom left side of your Zoom screen. You can also use the chat for communicating. We realize that question and answer time is important to you, and we try to categorize and address as many questions as possible. But if there are any unanswered questions at the end, we will always follow up via email. If you have suggestions for future COVID-19 ECHO topics, please share via the chat tool, or you can email us at echo@psu.edu. Please remember that if we are discussing cases, no personally identifiable information or PHI is allowed. We are recording these sessions, and we share all materials and recordings after the session. In the spirit of ECHO's all teach, all learn, we'll be on a first name basis during the session. Our ECHO sessions always begin with a brief lecture, and today's will be followed by discussion and question and answer. Our session today is on Efforts to Reach Minority Patients by Dr. William Calo. And again, there will be time for Q&A afterwards. But during the lecture, please feel free to put your questions into the chat. We'll monitor those questions. If you have answers, because this is all teach, all learn, feel free to post responses or questions. But we will have a team of other specialists from Penn State Health Online helping to address as well. And with that, I'm going to turn things over to William for our lecture.
Thank you so much, Jackie. It's a pleasure for me to be here today talking about the efforts to reach minority patients. And we have listened in the news a lot about about COVID-19, and we know coronavirus is affecting the life of everyone in the country, and including men and women, different racial ethnic groups, people from urban and rural places. But in this presentation, I want to focus on Blacks and Hispanics, and especially the Hispanic population here in Pennsylvania. We know some groups, some minority groups, are particularly affected by COVID-19, and this is causing major threats to the health and finances of these individuals and families. And now that we're talking about reopening businesses and the economy of the state, I think we have to discuss both issues hand in hand. Also, this issue about disparities in COVID-19 is critical in hotspot areas, and I'm going to be talking a little bit about that and showing some data about how important it is to address health disparities if we really want to stop the spread of the virus. And lastly, I want to be talking about three main factors that are driving these disparities in terms of exposure, vulnerability, and healthcare access. And I'll give you some examples of the work that we have been doing here in Pennsylvania, especially through Project ECHO and the REACH program to address these disparities. Let's start with some data. I want to just show some data about the impact of COVID-19. This is the data from the Pew Research Center. This was collected, as you can see in this figure, from March 16 to 20. And this is 6 weeks ago when we started talking about the pandemic in the US. If you see the question is about the percentage of people who say the coronavirus outbreak. At that time, we were talking about an outbreak, not a pandemic, and people were able to select the responses: a major threat, a minor threat, or not a threat to their personal health. Okay, so as you can see at the bottom of this figure, you can see that for whites, only 21% responded at the time that COVID-19 was a major threat to their personal health. But if you compare the responses of two other minority groups, in this case, Blacks and Hispanics, you can see that almost half of Blacks, 46%, responded that would be a major threat to their personal health, and 39%, over 1/3 of the population, would say is a major threat to them. And again, this data is weighted, so this is a good representation of how the adult population in the U.S. was thinking about COVID-19 6 weeks ago. So this was 6 weeks ago, 7 weeks ago. What's happening now? Okay, so let's some current data specifically for the Hispanic or Latino population, and I know they're not the same, but I'm going to be using the term Hispanics and Latinos interchangeably here. So this is some data. I was just collecting this data last week while preparing for this presentation. So you can see here the first line, Utah. 14% of the total population in Utah, 14% are Hispanics or Latinos. But the data that we have in terms of cases is that 35%, over 1/3 of the cases in Utah as of April 28, are coming from Hispanic or Latinos. You see, so there's the distribution of cases is higher than their actual distribution in the population. You can see the same is for Oregon. 13% of the population are Hispanics versus 26% of the COVID-19 cases are coming from people from a Hispanic origin. The same is happening in New Jersey. The same is happening in Washington. But I want to mention something that we have to, analyze or see this data with caution, because there's a lot of missing data in terms of race and ethnicity that we don't have. Okay. I look at the data, many of the dashboards, most of the states, and some of the data that CDC is presenting. At this point last week, when I was reviewing this data, only these four states were reporting a higher disproportion of COVID-19 cases for the Hispanic or Latino community as compared to their actual distribution. However, there were other 14 states that you can see the same stories for Blacks, okay? So this is something that is happening across the US for different racial ethnic groups. Something very important to take into account, and I'm just highlighting that issue about the missingness of the data. Just trying to move my areas. This is a very recent report last week from ABC News showing that minority groups are at risk as states. They're only providing partial COVID-19 racial data. And this is one of the main problems that we have. And if you can see the first line of the news article, race and ethnicity data is missing in over 50% of the cases federally reported. So 50% of the cases CDC has the data coming from the states, race and ethnicity is completely missing. And I think this is really important to get this data for many reasons. If we want to do our contact tracing, if we want to identify those hotspots areas, it's so important that we have this data so we can really prepare our public health efforts to target those families, those communities who are more impacted. When I was reading the news articles from ABC, again, taking into account CDC data, they made this comment. This is an actual quote from the article. Massachusetts and Pennsylvania, which together have more than 100,000 cases and nearly 5,000 deaths, are missing racial information in 50 to 70% of their cases because of incomplete reporting from healthcare providers. So I think that's a staggering figure. I think this is something that we have to address. Healthcare system, laboratories, community health centers. So we have to see the ways that we can collect and report this data, because it's so critical. I understand we have some challenges. I mean, about asking people about this information. But the better we collect and the better we report this data will really help us to protect the population and really target these communities. Again, more data here. This is actually from the CDC. Now we're moving from, I'm showing here some data about COVID-19 deaths. This is a screenshot, May 1st, from the CDC National Vital Statistics System. You see here is the US, and the indicator is the distribution of COVID-19 deaths. That's the first row, and the second row is the weighted distribution. When I look at the weighted distribution, because as we know, we use weighted population distribution to ensure the population estimates represent the US population. You see here different columns, non-Hispanic whites followed by blacks, then non-Hispanic American Indians or Alaskan Native, and then we have non-Hispanic Asians and Latinos. So look at the weighted distribution of the population. 18% of these deaths are coming from blacks, but look at this number, almost 27% of the deaths related to COVID-19 are coming from Hispanics. Okay, so this is not the actual distribution in the US. So this is showing that both blacks and both Hispanics are being disproportionately affected in terms of COVID-19 deaths in the US. What about Pennsylvania? Kind of a similar story to some extent. We're seeing here that in terms of Hispanics, 11% of those deaths are coming from the Hispanic group. Only 7% of the population in Pennsylvania are Hispanic. So you are seeing here that the Hispanic are accounting for 4 percentage points higher versus the actual distribution. But look at the data for blacks. This is surprising. This is probably 7-8 percentage points higher than the actual distribution in the population. So this is telling us that the Hispanic and Black communities here in Pennsylvania are also really impacted by COVID-19, and this data is for deaths. So moving forward, again, another news report showing that Latinos are proportionally dying and at the same time losing jobs because of the COVID-19. And I really like this coming from the person who was interviewed. Something has to change, okay? Something has to change. Is having a really impact on the community. And I like this news article because it's combining two things, health and the economic effect that some populations are having because COVID-19. And again, this is important to talk because these days we are reopening businesses and the economy here in the state. And I have some more data here. This is data 3 weeks ago, data asking people, this is now when we were just 3 weeks into the pandemic, is asking people if they have been laid off or lost their jobs because COVID-19. And I want you to look at the data, is the second set of numbers here. Only 24% of non-Hispanic whites responded that they have been laid off or lost their jobs. 32%, almost 1/3 of blacks responded yes, and 41% of them, of the Hispanic, has said that they have been losing their jobs. When you look at those, maybe still working, but those who have take a cut in pay, look at those numbers. Again, 29%, only 29% for whites. I mean, that's really bad. But look at the numbers for blacks, almost 1/3, and look at the number for Hispanic, 51%. So it's not that they're still working, but half of them have gotten a huge cut in their paycheck, and that has some repercussions for paying their rents, feeding their families, and purchasing some other basic needs. So this is showing that not only in terms of health disparities, but also in terms of disparities for their finances, Blacks and Hispanics have been really impacted by COVID-19. But the question is why some minority communities are susceptible to COVID-19 versus others. So the answer, based on some evidence that we have, is 3 reasons. There are many reasons, but you can put all those reasons into these 3 main buckets. The first one is something called differential exposure. I'm going to give you some examples in a moment, examples actually from the state. The second one is differential susceptibility, and the last one is access to healthcare. So let's start with exposure. Many Hispanic and Blacks work in frontline jobs, grocery stores, waste and recycling management, cleaning and sanitation services, and food delivery, putting them at contact exposure to people or materials or surfaces that may be infected with COVID-19. So because the jobs that these people are doing, they're constantly being exposed to COVID-19. And I want to emphasize something, and we're always talking about our clinical workforce as the frontline jobs, but you're seeing here that these people are the people who are, keeping the economy to some extent running these days. But these are people who have low-wage jobs. And now we're calling them that they are essential, okay? And they're being exposed. And this news from the New York Times, if you read the entire report and you see the images, farm workers, mostly undocumented, become essential during the pandemic. So these are the people who they don't have benefits. They cannot qualify for most of the economic relief programs that has been set by the federal government or many of the state governments. But now their jobs are essential. Okay, and this is a problem that we have to address. Taking care of these citizens, because right now these are the only people who are out there getting the crops for us to have something to eat. So when we go to the grocery store, these people are now essential workers. And we have not been thinking about them in that way until now. Another thing now, looking at some data here from Pennsylvania. This is a news report from York. I think many of you have seen these stories. Latinos in York are infected with COVID-19 at higher rate than others, 71%. Right? 71% of the cases in York are coming from Hispanic or Latinos. However, they only represent 1/3 of the city's total population. I was showing you some data about Pennsylvania, only 4 percentage point difference. Here, we're talking about more than 35% difference. So that's huge. That's huge. But why that's happening? And this is a report from April 16. You can see here another report 1 week later. York doctor finds ties between Latino coronavirus patients and poultry processing plant. Okay. And I think you have heard stories in Reading, in Lancaster, stories across the US about the issues that we have with the meat and poultry processing plants being shutting down because people are exposed to COVID-19, get positive. So this is happening here in our backyard. And most of the employees here in Pennsylvania who work in these plants are minority populations, especially Hispanic populations, okay? So why we're seeing so many Hispanics with being COVID-19 positive is because the type of work that they have. They're constantly exposed to other people or materials that are infected with COVID-19. The second thing that I mentioned you was vulnerability. And there are a few things here. We're always talking about you're more vulnerable to get COVID-19 if you're an older person or you have your immune system compromised. But we also know that there's some other underlying conditions that may increase your may decrease your COVID-19 outcomes if you are infected. So although having a chronic disease does not increase the risk of contracting COVID-19, it can worsen the outcomes of coronavirus. We have emerging data showing that among those who died of COVID-19, the leading underlying conditions were hypertension and diabetes. And a few weeks ago, we have a special ECHO session in Spanish for the Hispanic community talking about diabetes management, because this is so important these days. Why? Hispanic and Blacks have high rates of both hypertension and diabetes, and that's also true for the Hispanic community here in central Pennsylvania. They have higher rates of hypertension and diabetes, so if these people get sick, get infected with COVID-19, they will have worse health outcomes. And that's the reason you are seeing so many health leaders and public health officials in some of our communities, especially in central PA, saying that this is a perfect storm for the Latino community, not only to get infected, but maybe to have worse outcomes if they are infected, not only in Lebanon, but also in Berks. So we're talking about York, we're talking about Hazleton, we're talking about Lebanon, we're talking about Reading, we're talking about Philadelphia. This is happening all across the state. And the last thing is limited healthcare access. I think you all know that Hispanic are the largest population segment without health insurance coverage in the US. Almost 1/4 of them are uninsured, leaving those people with presumptive symptoms or with positive COVID-19 tests with limited access to needed healthcare. I want to just make something here. Although I'm focusing. I know some people have been joining recently the session. I'm focusing my talk about Latinos, but I think this is important for Black, our rural population, Asian. So this is important. However, I'm just focusing here on Latinos. I mean, there's some good news. There's some good news in terms of providing access to underserved populations. This is the CARES Act. I think most of you know about this law because the $1,200 checks, but that provides more. This is the Coronavirus Aid Relief and Economic Security Act. It provides some relief during the pandemic. The checks is one of them, but they have so many other provisions. You have to put this new law combination with another one that was approved, I think maybe early April. And that one is the Families for Coronavirus Response Act. Those two, basically in terms of healthcare access, what they're doing is that they are providing free COVID-19 testing to all individuals enrolled in any of these health plans, from employer-sponsored group health plans, Medicare, Medicaid, CHIP, TRICARE, Veterans Affairs, and some other healthcare plans in the US. So testing is basically free because there is no copay or any other cost associated to the individuals. Some people have been, there have been some discussions about, I'm getting my test, but I'm still receiving a bill. There's some loopholes. There's some loopholes in the law. If you go, it all depends on the type of healthcare insurance that you have. The test is going to be free, but if you get any other testing or procedure during that clinical encounter, you will still owe for that other services that you get. The test will be free, but any other thing that happened during that clinical encounter, you may owe some money, some deductible or copayment. Second, it creates the emergency paid sick leave and emergency family medical leave for some employees. Again, there's some gaps here in the law. This is only applying for most of the businesses that have between 50 employees to 500 of them. So people who are over the 500 employees, this is not applying to them, and small businesses with less than 50 employees is not applying to them, with some exceptions, okay? Another thing is that many of these benefits or relief, they have different dates. So for example, there's funding for telehealth. That funding from CARES is for the next 5 years. However, these two emergency paid sick leave and emergency family leave provisions in the law are only applying until December 31st of this year. So many of these provisions, we have different deadlines. So people have to be aware about when they can have access. So at least the good news here is that especially for low-income families and minority families, that they will need, or maybe our all population, that they may rely on Medicare, Medicaid, they have COVID-19 testing covered. Also, it's not included here, but any future vaccine for COVID-19 based on these two laws will be fully free to all individuals. Also, I think, again, I mean, it's not only health, but nutrition is also important. The CARES Act provides some funding for nutrition programs. Again, most of the minority populations and low-income families benefit from this program. The first one is SNAP. They're getting $15 billion. The reason for that is because there are many people losing jobs and losing their income, so they will qualify for SNAP right now. So this $15 billion is going for these new families who are going to be benefiting for this program. There are two caveats here. There's no change in eligibility criteria, and there's no expanded benefits. That means that the amount of money that you receive a year ago is the same that you will be receiving now. So there's no extra money, and there's no expanded eligibility criteria. So those are the same. However, CARES Act is giving some flexibility to the states in the way they can process the benefits, and I'll show you some examples in a minute. And second, I think most important, also important, is that there's another $9 billion to meals for children while schools are closed. So these two things are really important. Healthy nutrition is part of being healthy. So here is what I want to mention about the process for getting SNAP. I mean, the system is completely overwhelmed with, I mean, people requesting unemployed benefits, SNAP benefits. So states have gotten some flexibility in the way they can process those applications. Here you can see how Pennsylvania compared with some other states. Again, this figure evolves every time. States are able to request some of these waivers for some time, or they can just opt out not to participate. I don't have any specific reason why Pennsylvania is not requesting all waivers. It's the reason that they have, but as you can see here, Arizona, Pennsylvania have been very active requesting waivers just to speed up the process and be more flexible with the way people can request that. And here in Pennsylvania, it seems that these are more related to the interview process that people need to go through in order to qualify. But more information is at the end of the presentation. So this is the last section of my presentation is I have been spending the first 20-25 minutes talking about statistics, number, how our Hispanic community here in Pennsylvania have been impacted, and the data. but I think the important thing to discuss is what are we doing, okay? And that's what I want to spend the last 10 minutes. What we're doing here to try to address these issues. Better Together Reach. That's a CDC funded program that we have here at Penn State College of Medicine. Is a community academic coalition. Is led by Penn State. The PI is Jim Krasnowski. I'm the co-leader of that grant, and we're working to communities in Lebanon and Reading. Those are two communities that are Hispanic majority communities, and what we try to do there is try to reduce health disparities related to chronic diseases among Hispanics in these two communities. What are we doing? We're doing a lot of health and nutrition programming. We're doing physical activity opportunities, and we're doing diabetes prevention programs. And I think this is really important because, as I mentioned you before, chronic disease, if you have COVID-19 and you have an existing chronic disease condition, you may have worse health outcomes. The bad news, those are the good news. The bad news is that many of these initiatives, what we have been doing for the last 2 years, have been paused following CDC's social distancing guidelines and Pennsylvania stay-at-home orders. The reason is many of these activities are in person or involve large community gatherings, okay? So we're not able to do that. On top of that, most of our local and state partners are now facing an increased demand in health and social services without having additional resources. And again, many of these people, they have staff who are sick. They have been losing revenue as well. So now they have more work to do with less resources and less staff. What has not stopped or paused in the face of this pandemic is the commitment of all these community partners to serve the Hispanic communities in Lebanon and Reading in this time. That has not been paused, and we have found ways to, with the permission of CDC, redeploy our resources, redeploy our staff to do some COVID-19 outreach in our community. This is one example. This is Madeline Bermudez, our community health worker. This is she leading one of the conference call with community leaders and healthcare system in Lebanon County to discuss the needs of Hispanic residents regarding COVID-19. And she is having these calls almost every other day. We have a second community health worker in Reading, in Berks County. She's also doing that. So we are in constant communication with our community leaders to understand what are those needs. And basically, there are two things that they're telling us. They need information in order to stay informed about best practices. Most of the information 6 weeks ago was in English, not available in Spanish. And second, they have so many questions about emergency lodging, food access, unemployment benefit, how they can pay utility benefits. Again, remember, many of these people, they will not qualify for if they're immigrants, they will not qualify for federal relief programs. At the same time, many of the information is not in Spanish. So we have been collecting this information for them. Here are some examples. This is promotional material that we have developed in collaboration with one of our community partners, Wellspan in Lebanon. These have been published in La Voz Latina Central, which is one of the main newspaper in the region. And it's just telling people, I know many of you can read Spanish, some of you cannot. This is just telling people what you should do and what you should not do if you have COVID-19 symptoms. So this is one of, I think right now we have a library, something between 15 to 20 different resources that we have been adapted or created using evidence information from the CDC. So we're taking the information from the CDC and putting these informational resources for our Spanish community in Central PA. Another example here, again, you can see two things here in this slide. On the left side of the screen, this is about utility services, unemployment benefits, emergency lodging, things that we know are important for people who are losing their jobs, okay? So we put these resources and the phone numbers, making sure that there's someone who can answer that phone or answer that email in Spanish, okay? So we're putting that there. This is specific for Lebanon. We also have one for our second intervention site, Berks County. On the right side of the screen, this is a postcard, and we're putting all these, we're developing all these, and we're disseminating these materials electronically to all our partners. We have more than 25 of them, both Lebanon and Reading, but we are printing them out. And we're taking this, the one that you're seeing on the right side, it's kind of a size of an index card. We're bringing these, our community health workers are bringing these resources to grocery stores, gas stations, corner stores, healthcare system, and we're leaving these materials there so people can have access them, or the healthcare system can distribute them with the Latino community. The one on the right is about mental health. What happens if you feel anxious or if you have depression, where to call, and we provide the number of 3 places where Spanish-speaking, they can get Spanish-speaking help if they call. Also, and I'm very, very happy about this one, very proud of this work. This is something that we're doing, a collaboration between Project ECHO and the REACH program. This is our special community-facing series in Spanish for the Hispanic community. So far, we have delivered 3. The 4th one is this Wednesday, and you can see the topics on the right side of the screen. We're not only reaching Hispanics in Pennsylvania, we are reaching Hispanic in 12 different states. That's the data that we have. And we have people joining as far as Puerto Rico, Mexico, Colombia, Peru, and Dominican Republic. So from little Central PA, we're reaching a good portion of the U.S. and 5 other Latin American countries. So this is a great work that we're doing. And again, our community health workers are understanding the needs of our communities, and we're just making sure that we have sessions and speakers to try to answer those needs that we have already identified. Oh, this is me. And this is also very involved in the news. I think there's another opportunity, not only reaching out to the Hispanic community, but also I think it's important to provide this message to the general public here in Pennsylvania about how important it is to take care of our minority communities. This was an interview that I did to PCN, the Pennsylvania Cable Network, last week. Really, really happy. It was a 15-minute interview. I never done one of those, so pretty cool. So the take-home message that I have, the first one is that we really need to improve the collection of racial and ethnic data. And again, because that is connected to the occupation of the people. Some people are exposed to COVID-19 more than others because of occupation. I think we have to improve our collection of racial ethnic data and occupational data if we really need to target those communities in need. The second thing, as we did with our limited reach, staff and resources or programs can employ similar promising strategies to communicate with community leaders. And if you want to access our resources in Spanish, we can provide them to you guys for free. We can put them in the box folder. If you think there's any other material that you would like to see, just tell us some ideas, and we have the staff ready for making those. And the third point that I want to bring today is that delivering these Spanish language community-facing echo sessions have been an invaluable asset to connect hard-to-reach populations with best practice communication about COVID-19. We're doing this through Zoom platform, like similar that you guys are doing right now, but we're also connecting these sessions via Facebook Live. So we're doing dual streaming, Zoom and Facebook Live. And the first one that I was the speaker, we got almost 300 people connecting both platforms. And I think that's the number that we're getting almost every single week, 200 to 300 people. So this is a great opportunity. We're targeting community leaders. That's the people that we have information of them. But I think with Facebook Live, we're able to reach other people across the state. I don't have any specific case presentation today, but in terms of resources or question, if you want to learn more about the REACH program, or you need resources in Spanish for your patients, just contact Andrew Murray or visit our website, and we're happy to provide those resources for you at no cost. So I just want to open the floor for any Q&As.
Thank you for that, William. I do want to ask, we have the Spanish echoes recorded, correct? And they're on our YouTube channel. So we'll make sure that those links are available as well. So there was a comment in the box, Saray, I'm sorry if I'm pronouncing that wrong, that indicated that the one brochure was nice in Spanish and they need that in New York City.
Yeah.
Go ahead, please.
Okay, good evening, everyone. Yes, I'm a community health worker for the sickle cell community in SCTPN, Sickle Cell Thalassemia Patient Network, a nonprofit organization. And yes, we need this information in Spanish because there's a lot of Spanish population patients that are living in the 5 boroughs that need this information.
Yeah, absolutely. We can make those available. Absolutely.
Yeah, I'll write down my email address, and definitely because yes, I've been talking to patients every day, as far as, you know, every single day, ask me questions about the COVID-19, even with schools. Right now, since I'm doing transition teens from ages 16 to 21, and with 3 hospitals I'm doing, and right now I'm working from home, that a lot of parents that that don't speak English, that they need some resources in Spanish for their children as well. Also, do you have the homeschooling tips too?
I have to check the resources that we have in box, but I will give you access to all the resources that we have. Sorry.
Okay. Thank you so much. I appreciate it.
Yeah, we have your information. It's in the chat box with your email. So I will let Andrew Murray. I will connect you with Andrew Murray so she can give you access and electronically or any print copies that you may need.
Thank you so much. We appreciate it. Yep. Because I can give it to my supervisor. That's why. All right.
So thank you for that, for bringing that up. Are there other questions or comments? Feel free to unmute your microphone or place items into the chat box.
There's no more comments. I think you guys can use the next 15 minutes for going outside for a walk.
Well, that sounds wonderful.
It's a nice day outside.
It is one of the last for a few more days, I believe.
Yeah.
So real quick closing announcements. And again, if you do have anything, please put it into the chat. But remember, you can collect CMEs for participating today. Fill out the survey that comes out after the session, and you can use that same survey for every session that you attend. All materials will be shared via email. And we also ask you to consider submitting case discussions for future sessions. And finally, we hope you'll join us for the next ECHO session, which ironically is, it's in Spanish. It's Healthy and Active Families During COVID-19, and that will be held on Wednesday, May 6th at 2 p.m. And please continue to watch your email for future sessions. Thank you, everyone.